Hello, Rahul. Hello, Rahul. Hello, Rahul.
Sir, good morning.
I'm not able to share my screen. Host disabled attendees screen sharing.
Yeah, just a minute. Hello. Pranav sir, now you are able to share the screen? Pranav sir.
एडवांस सेटिंग पे किसी के एडवांस सेटिंग है
Pranav sir, good morning.
Hello.
Hello, Pranav sir, good morning. Now you are able to share the screen?
Let me check.
Yeah.
Yeah.
Okay.
Yes. Are you guys able to see?
Just a minute, sir. Pranav sir, just 1 minute.
Okay.
Hello. Good morning, everyone. So today we'll be starting the second session. The first lecture will be given by Dr. Pranav Ingole, sir, Associate Professor in the Department of Oral and Maxillofacial Surgery, and sir will be talking on the Operation Theatre protocols. Over to you, sir. You can start the lecture. Thank you.
Okay. Thank you, Rahul, for your kind introduction. So, good morning to everyone. Rahul, should I start or should I wait some more participants to add? Hello.
Yes, sir. You can start the presentation.
Okay.
Okay. Thank you.
So very good morning. So first of all, I would like to congratulate all the final year media students for clearing their exams and achieving one milestone in their life. And once again, a very good morning to all dear so-called the students have now become the interns. So good morning, dear interns. You will be called interns for the next 1 year, and after that you will be awarded a graduation or a BDS degree. So welcome to yet another session of Interns Orientation Program 2021. So aim of the Interns Orientation Program is to orient the interns about the work culture of every department. Till final year, you guys were very much exam oriented, but now you have to apply your skill and knowledge and work on the patient, which will be which will again inculcate in your private practice. So orientation for interns is now headed by the Department of Oral and Maxillofacial Surgery. So till now in oral and maxillofacial surgery department, you must have in the yesterday's lecture, you have been introduced to the local anesthetic agents and techniques. Then I think Kolte ma'am must have talked on infection control, then scope of OMFS and principles of exodoncia. Today I will be talking on the OT protocols, and the rest of the two lectures will be taken by on the topic of medically compromised patient and medical emergencies. So in internship, you have got a chance to do the exodoncia and assist in the minor OT. You'll get the chance, but along with this, you will also get a chance to observe and assist in OT. But OT is a highly sterile place than other places in our hospital. So to enter the OT, you have to follow some rules and etiquettes. So in this lecture, we'll be discussing about all these etiquettes and manners. So what is the operation theater? Operation theater, basically, it is a hospital where the surgical operations are carried out in a sterile environment. Historically, if we look at the operation theater, the term operating theater is referred to a non-sterile tired theater or amphitheater in which students and other spectators could watch the surgeons perform surgery live. So these are you can see the typical old operation theaters. It is somewhat like an amphitheater. You can see in the center there is an operation table and the surgeons are performing the surgery and the students or the spectators are watching the live surgery. But with the time, everything has changed. So this is the era of new modular OT. Here you can see at the top there is a laminar flow, advanced operation table. All the walls are covered with the epoxy resin, so there should not be any means to sterile the walls efficiently. There are a lot of monitors for anesthetists to monitor the patient's vitals, then cauteries, suctions, and many number of advanced things which has been added to the operation theaters nowadays. So my scope of discussion, basically it will be interns centered. So while entering the OT, you have to change your dress. Then after entering the OT, where to go, you have to introduce yourself to the OT staff. Then I will be introducing with the basic OT equipments, then what to do and not to do in the OT, and code of conduct in OT. So the basic aim of this lecture is to orient you with the sterilization protocols or the strict OT protocols to be followed in the operation theater. So there are a lot of do's and don'ts in the OTs. OT is a very highly sterile place, so you have to follow strict protocols. So before entering the OT, you have to prepare yourself a day right way. So make sure that you have taken sufficient food, because in the OT you might get a blood field to see a lot of the newcomers. Those who see the blood fields have a tendency to get a vasovagal syncope. So get yourself good food, then complete your washroom routine, go to your washrooms and complete all these procedures, because in OT again it will be difficult for you to go again and again to the washrooms. Then please take your phone on the silent mode, and as soon as you enter to the OT, please introduce yourself to the staff, like nursing staff, that you are an intern, you are the first comer. Otherwise they will kick you out of the OT, that who are you. So the basic home rules that mandate before entering. So before entering the operation theater, at the door, you will get a well laundered, clean two-piece scrub suit, head cap, disposable mask, and a proper footwear. These are all basically to The scrub suit is made up of cotton with a high view density that minimizes the risk of bacterial strike through. These should be changed immediately if the soil is contaminated. So the first thing which you will get at the entrance is the surgical suit or the OT dress. So you have to wear this. You have to remove your all. You will get a girls changing room and a boys changing room. You have to go there. You have to keep your means dresses which have come from the home and wear these surgical dresses, which will protect you from the cross infection from the patients and patients blood stains and lot of things that are going to happen. Then another important thing in the OT dress is you should not wear under your OT dress on the t-shirt or a shirt, which is not allowed at all. Then head cap is the most important which will be required to put on your head, which will again protect you from the cross infections. Specifically, the girls should tuck in their hairs inside the head cap, as it is shown in the second image. You can see entire hairs are tucked in. Then the most important is the footwear. The basic requirement for the footwears is these kind of the footwears which are ventilated at the lateral surfaces of the the Crocs. The Crocs with the holes basic not allowed in the OT because the blood might spill and fall on your leg and it will again means but you being an intern, you don't need to if you are having these kind of the footwears, it's okay, but you can also wear basically the slippers inside the OT. So the face mask, you know that wear them as microorganisms are expelled through talking, coughing and sneezing. Mask should mold around the nose and under the chin. You need a visor mask or the goggles when scrubbed to protect against the splashes of the body fluid. The mask is a surgery intended to be worn by the healthy professionals during surgery and during nursing to catch the bacteria shed in the liquid droplets and aerosols from the wearer's mouth and nose. So again, you know that this is a COVID era. The mask is the most important. So nowadays, if you are having the N95 mask of the 3M, you can use while entering the operation theater, or basic 3M 3-ply mask is also sufficient while entering the operation theater. Then please remove all the accessories such as watches, rings, bangles, necklaces, earrings, because all these things might carry the bacterial and contaminate the OT. So please remove all these, especially the girls. Then the etiquettes in OT, the consideration considered, you are whenever you are talking, the sound is going to travel, because in the OT it is a silent zone. So please do not talk or chit chat. Then consider how many people are already in the space. If you are entering the first time, please ask the sisters and the ward boys, those who are there, about where to stand, what to do. So it's very important to maintain the sterile zone there. So please follow the OT etiquettes. Then where to stand again, as you are the newcomer, you are the observer. So where to stand is the big question for a newcomer. So please, I'm going to show you that which are the sterile zone where you should not come in contact. Otherwise, you can be just stand away means before the surgery started. Once the surgery started, you can come little closer to the OT table, but you should not touch the surgeon or the OT table or the scrub sister. Then, as I told you, you can see these are all the sterile zone. You are not at all allowed to touch or accidentally touch all these sterile zone. And this is a typical diagram. You can see this is a OT table. This is the head end. Here the anesthesia. Anesthetist is anesthetist standing. Here the anesthesia machine. Here the surgeon. This is the assistant. This is the scrub sister. These are the electrosurgical unit. This is the typical diagram. for the operation theater. This entire zone is a very, very, very sterile zone. You should not come and touch or contaminate this zone. So if the surgeon asks you to assist in the case, so be gentle and tell the OT sister or the OT ward boys that you are the first comer. Take the help of them. How to get scrubbed? I think Kulte ma'am must have told you the technique of scrubbing thoroughly before doing any surgical case. Wear the gown, gloves properly, and then only come to assist. So this is a typical scrub station. You can see these are all the angulated basins where the water from your elbows will go directly to the drainage. So, and another etiquette is not to disturb. Please keep your mobiles on the silent zone, because surgeon prefer that what they are doing has your their attentions should not be violated. Then patient confidentiality is very important. You being an intern, you are not supposed to take any photographs without the consent of the surgeon or the postgraduate students who are there. If they request you to take the photograph on their mobile or on their camera, then only please do go ahead with that. Do not take photographs in the OT without the consent of surgeons and PG students. Then when to ask the question, normally the surgeon, whenever the surgeon is operating, he will keep on commenting on what he is doing to the two postgraduate students and to you. If you have any query with a very mild voice, you can just ask the question to the surgeon or the postgraduate student. Questions are always allowed in the OT. That is not a problem. Then respect the OT staff. Sometimes you might feel that OT staff is very rude. So please respect them, because they are doing for the safety of patient, because this is a strict sterile zone. It is nothing personal that they are going to shout on you. If they shout on you also, it's just a normal thing. It's just for the betterment of the patient. So the coming after doing all this, wearing the surgical scrubs, mask and head cap and the footwear, these are the people who might you meet in the OT. The most the first the person which are you going to meet is the patient. Of course, the patient, if he's in the pre-op area, please do not talk about any surgical complications in front of the patient, because he's already in so much anxiety. So do not increase his anxiety. The second most important person in the OT is the anesthetist. He will be in the non-sterile zone, but he will provide the anesthesia throughout the operation theater. Then the most important is the surgeon assistant, that is the residents and the you will meet the postgraduate student. They will be in the sterile zone. So, and you can ask them a lot of questions. The next is the scrub nurse. She will be again also in the sterile zone. So she will usually set up all the OT tables, give the surgeon gowns, gloves, and everything, and she will be assisting the surgeon. Then another is the circulating nurse or the circulating. This person is again will be in the non-sterile zone, but his work is to provide the sterile instruments on the OT table or on the OT trolley. So this is the basic operating room. Here you can see the surgical team will consist of chief surgeon, then assistant surgeon, anesthesiologist, scrub nurse, and the circulating nurse. Here you can see this is the anesthetist surgeon. The surgeon is operating with his assistant surgeon. This is the with the OT trolley, and this is the circulating nurse. Typical diagram for an operating procedure. So coming to the next is introduction to the important OT equipment. So I will be just telling you the only importance, such as OT table, boils apparatus, that is anesthesia machine, various cauteries, OT lights, monitors, suction machines. So the first most important equipment in the operation theater is the operation table. The OT table is designed in such a way that it is capable of adjustment to provide different positions for various surgical procedures. In this, the OT table, the height can be adjusted, neck flex can be adjusted, head up, head down can be adjusted. The second most important is the surgical ceiling light. These surgical are intended to assist the medical personnel during surgical procedure by illumination of a local area or the cavity of the patient during the surgery. Nowadays, the shadowless OT lights have come. During the surgery, the shadow of person's head doesn't come between the surgical field. Then another most important machine is the anesthesia machine or the Boltz apparatus. Nowadays, you can see these are all advanced anesthesia machines fitted with monitors, ventilators, and lot of anesthetic gases can be transmitted to the patient through this machine. Then another, you will not going to see the lot of monitors. So this, you can see, this is a typical monitors which is showing pulse rate, heart rate, BP, and the saturation level. Along with this, you can see various ECG monitors with pulse oximeters and blood glucose meter. These are all handled by anesthetists, which keeps very keen monitoring on the patient's important vitals. The another important machine is the suction machine, which the surgeon needs continuously while operating. Then cautery, the electrosurgery, it is one of the most important for the newer generation of surgeons. Without cautery, the surgeons cannot operate. It is basically, electrosurgery is the application of high frequency electric current to biological tissue as a means to cut, coagulate, desiccate, or fulgurate tissue. Electrosurgical devices are frequently used during surgical operations, helping to prevent blood loss in the hospital operating rooms or in outpatient procedure. So it is another important equipment during the surgery. So this is basically, you can see the OT diagram, I can say layout. Here you can see this is a sterilizing room. This is two operation theater. From here to enter the OT, the first you will get at the door you will get the scrubs or the OT suits. First thing which you see is a doctor's changing room. Go there, change your OT dress. Then once you enter the OT zone, the most important, this is all unsterile zone. Here you will get lot of basins to hand wash. Then the scrubbing area. Then this is a sterile area, and with these the two theaters are adjoined. Here you can also get an anesthetist room, cleaner's room, and the sister's room. So in conclusion, the operation theater in the hospital is a highly critical and complex area which requires high hygienic standards. The certain code of conduct must be followed at all the times to maintain pedagogical model for excellence. To maintain the sanity and the of sterile field is utmost important. So the takeaway message, the core idea of possessing certain etiquettes and mannerism is therefore essential for excellence and safety in the patient care and a good outcome. Do not breach the sterilization protocol in the OT. Let us revisit these sequential to better equip ourselves to our temple of work, that is the operation theater. Thank you, guys.
Hello, thank you so much, sir, for the wonderful presentation and giving each and every details of the operation theater protocols and inside the OT what we have to follow. So this will definitely be helpful for the interns when they will be entering in the OT for the first.
What happened, Elima?
Not able to reach.
Hello? Hello? Hello?
Yes, sir.
Now?
Yes, sir, we can hear you.
Okay. Mala, Nilima wants to add up something. I heard her voice.
No, sir.
Okay.
Thank you, sir. Thank you so
shall
much.
I take? Yeah. Thank you.
Thank you, sir. Thank you. So next speaker. Hello, good morning, sir. Are you able to hear?
Good morning, Rahul.
Yes, sir. Thank you so much for joining us. So next speaker will be Dr. Kshitij Bang. He's Associate Professor in the Department of Oral and Maxillofacial Surgery. And sir will be talking on the medical emergencies. Management of a medically compromised patient. Okay. So using the lecture.
All the interns for passing in final year and joining the internship, and welcome to internship. Now, as everything is getting normalized, soon you will be starting doing patients also. So whenever we start patient, usually we focus more on dentistry. Like if you are posted in prosto, you will be focusing on crown preparation, in oral surgery extraction, in endo, like I want to do root canal. But usually we focus just on skill. But the more important thing is the patient comes to you as a whole, not just for dental tooth management. So we should focus on everything. The first important thing is we should focus on whether the patient is fit for the given treatment. That fitness part has to be evaluated. Now, because a person may have some medical conditions, some diseases also. So how would you come to know to these situations? The first thing and most important thing is medical history. We should never skip this part whenever we come to start a treatment. Sometimes it's tempting कि मुझे ये patient मिल गया, चलो start करती हूँ, but never skip this part. This part is very important. Now in medical history, pro forma is usually there in each department, and we should go through this. There are many situations. The common one, we will try to briefly cover them. It's beyond the scope of this lecture to cover each and everything in detail, but just to sensitize you, to prepare you how you should start doing patient, this presentation is made. Now, which are medical conditions or common things which patient may have, and you should ask them and be prepared in your mind that these situations may occur and how to deal with them. The first important thing is proper assessment of any given situation. So like a person, you may ask asthma history. First, open question you may ask, like, do you have any medical conditions or any diseases? That is the first thing we should ask the patient. From that only we will come to know many things. He will tell that I suffered from this, I suffered from this. The next thing you should ask, duration. Then severity, कि कितनी severity का है वो, कब से हो रहा है. Then is he taking any medications for the, this is in generic way we are discussing, for any medical disease. Like which medications he is taking. I'm audible na? Is it clear?
Yes, sir.
Yes, sir. Yes, sir.
Yeah, the disadvantage with this is that it's completely one-way communication. But the advantage is at your comfort level, you are listening to this. So in generic way, we are discussing this like history, duration, then severity, then which medications he is taking for that. Suppose we are discussing asthma. So if he is taking some inhaler, so we should ask them to bring the inhaler with him themselves on the day of procedure. And if the severity is more of asthma, we can ask them to use it once before you start the treatment. So that is important thing. Now in history, generally patient will tell if something he is having, or if you want, you can pinpoint them that do you have asthma, do you have any cardiovascular, in their own terms which they can understand. And if you are in doubt, if you don't get anything from this thing history, then you can ask for some investigations. Like old age patient, if they don't give any history, still you can ask for like random blood sugar, CBC. These investigations we may advise, and if needed we can take physician consultation. So this is in brief preparation of the patient before starting the dental treatment. Like you all must be knowing about asthma. What happens in this, that a patient has difficulty in breathing. So we should be prepared that inhaler he should have. Then if it occurs, how should we position the patient? These are the things we should have in mind. Diabetes mellitus, this is one of the common medical situation. Patient usually from long time they are on tablets, or some patients are on insulins also. So we should ask history कब से है, क्या लेते हो उसके लिए, and we should take random blood sugar if needed, fasting and post meal. If needed, physician consultation is needed. In detail also we will see in short how to manage these patients. Then hypertension, again a common situation. In further slides we will discuss this. Then tuberculosis, this is one of the common disease in India and Asian continent. So we should ask history of tuberculosis or long-term cough tha kya, because this can transfer from person to person. So we should be careful about that, whether he has taken the proper medications, completed the course. Now, any infectious diseases like nowadays COVID is also there. So we should be careful about these things, whether patient has a history or family history of any of the infectious diseases. Now, previous hospitalization, this again give a lot of information we can get from this. Again, a random question, open question we can ask to person, like in your life, any of the time you got hospitalized. From that, we will come to know, does he have any of the medical disease or any trauma, history of fall or anything, we get information. Then blood discrepancies like bleeding disorders or clotting disorders, we should ask. History of blood transfusion, why it was given, and repeated blood transfusion again increases the risk of like transfusion disorders. Then this is again very important thing, allergy. So allergy to any food or any drug. If he has allergy, we should be prepared with emergency drugs like anti-allergic drugs like adrenaline and steroids. And local anesthesia sensitivity test also we do. If the patient doesn't have history of taking lignocaine or anything, the first thing we do is we test it intradermally or subcutaneously. Test dose is given and we check for the sensitivity, and then only we start giving lignocaine block. So these are common systemic diseases which we should be knowing, and we should be looking for their possibility in the patients. Most of the things we have covered, like infective enterocolitis. In this we need to give antibiotic prophylaxis, and this we will discuss in further slide. This is one of the most common thing, diabetes mellitus. So in this normal blood sugar level we should be knowing, and up to which level like we can do it, and if needed. These are common findings, oral findings in uncontrolled diabetes, which are usually there. They have a typical foul smell they have. From that only we can come to know that patient may have diabetes. Typical smell we can get. So prior to starting any treatment, a diabetes level should be controlled, well controlled. Otherwise healing issues will be there, and chances of spread of the infections are also there. Unless it's an emergency like an abscess, then only we may put a nick and drain it. All dental other treatment should be postponed till the time diabetes is well controlled. So surgery until the diabetes patient physician. In these patients, try to schedule morning patient on morning, and try to keep your duration of procedure short only. Don't give lengthy appointments. Try to give a stress reduction protocol, that is anxiety reduction protocol, and avoid deep sedation techniques in outpatients. In all the patients, we should try to monitor the pulse, especially in medically compromised patient. We should monitor pulse, respiration, blood pressure during and before procedure. And communication is very important part in dealing with these patients. That will build confidence also, and we will be aware what's going on with the patient. Don't focus just on work. See whether patient is comfortable, whether the anesthesia is adequate, whether he is having perspiration or some discomfort he is having. So ask patient, are you comfortable in between? And this is most important part when dealing with the diabetes patients. To maintain their sugar level, they usually take tablets or insulin, especially in cases where those are insulin, they take insulin just prior to the meals. And if they skip the meals, if they take the insulin, don't take the meal, then there are high chances that they may get hypoglycemics. So this is very important. If you are scheduling the early morning appointment, then make sure that they have taken insulin and taken breakfast also. If they have skipped the breakfast, that is critical. They may get hypoglycemic shock. So try to maintain that things. If hypoglycemic episode occur, if patient get unconscious, so what to do? If it is a mild, then patient is conscious, then give glucose, monitor vital signs. And if patient is unconscious, you cannot give orally, so you need to inject the 50% glucose, or glucagon can be given. So these are the medical drugs these are drugs kept in emergencies. So the next presentation will be by Dr. Nilima. She will be covering management of these things, medical emergencies. Now next part is CVS, that is cardiovascular disease. This encompasses many things, right from hypertension to ischemic heart diseases to valvular defects. So a gross history has to be asked for any of these things. The patient, or you may ask the patients related to these things, like do you anytime suffered from chest pain or dyspnea, cyanosis, do you felt palpitations, or anytime fainting? So such thing, or edema on fit, you can observe. Whether you may get information from history or from asking for these things. Easy fatigability, these things we should be looking for. Now common entity is hypertension, and very easily we can diagnose just from taking the blood pressure. We will come to know whether he is suffering or not. Sometimes it is because of apprehension also. So usually what we make is make patient comfortable for 5 to 10 minutes, and then only we take this in a lying posture, supine posture. The critical thing is the level which we should know is 140 and 90. Below this we can do extractions or the procedures. Above this, try to consult physician for either starting the medications, or if he is already on antihypertensive, we may have to alter. Not we, means physician have to alter the dose of the antihypertensive. Now again, when we are doing local anesthesia part, we have lignocaine with adrenaline and without adrenaline. So whenever patient gives cardiac history, we may use lignocaine without adrenaline because epinephrine affects the cardiac functioning. If needed, if we feel that, because when we will start doing patient, you will experience that lignocaine without adrenaline doesn't give that potent anesthesia. Sometimes even after giving a good block, the patient still complains of pain. If you need profound anesthesia, you may use lignocaine with adrenaline, but that safe dose is given. So that you should be knowing. You all must be knowing what is the maximum safe dose of lignocaine of the. These are things. But in healthy patient and in cardiac, that is now maybe the content of lignocaine with adrenaline in 1:2 lakh में कितना होता है, 1:80,000 में कितना है, या 1 lakh में कितना है, how much I can inject. Usually it is 4 ml we can inject with adrenaline in cardiac patients. So these levels you should be knowing. Like it is 0.2 milligram in healthy and 0.04 milligram in cardiac. You must be fresh with this information. So use anxiety reduction protocol always. This is important, especially in hypertensive patient. If you are not looking confident, then it's obvious that normal patient will also feel like having hypertension. So you should look confident to do your work. Don't discuss in front of patient, or don't look panic. Sometimes it happens that you are new with the procedure, like even with giving the block, when we see final years, when they are doing first time the local anesthesia, patient get faint. The reason is because they see that the doctor is not looking confident. So this part is very important. Be prepared with what you are going to do. Then this is again important. Usually we do the patient in supine. You people do extractions as per the quadrant, take positions, but whenever we do minor procedure like PGs, they usually do in supine posture, and sitting dentist is they practice. So posture change is very important. After doing the work, if we rapidly change the posture, there are chances that hypotensive, they may get postural hypotension. So gradually change the posture and observe. When the patient exit from the chair, it's not that your job is done. You should be observing the patients, that whether he is getting fainting. This is very important. Usually patient gets fainting after you finish your work, or at the time of anesthesia, or after you finish work, and when patient is going out from the OPD, he gets fainting. So that should be observed. Rapid posture changes should not be done. Now next is angina. This is a pain, and severe part is myocardial infarction. So this is of the reduced blood supply to the cardium, the muscles of the heart. So this is usually become some clot in the vessels of myocardium, coronary vessels. It will lead to reduce oxygen supply to the muscle. Pain will be there. So such patients, again same thing, medical consultation has to be taken if such history is there about the fitness for the procedure you are doing. And usually these patients are on antiplatelet. What is antiplatelet, or can you name antiplatelet drug from interns? Am I audible? This is one of the yes. Name any antiplatelet drug. Am I audible? Anyone from intern?
Aspirin.
Sir, aspirin.
Very good, very good. So you all should be knowing aspirin, because this is one of the most commonly prescribed medication. And most of the patient above age of 50, if they have any episode of cardiac disease, usually on a safer side, they are prescribed antiplatelet drug, that is aspirin, and sometimes clopidogrel also. But at least aspirin you all should be knowing. और आप ऐसे पूछ सकते हो कि कोई खून पतला होने की दवाई, you all must be asking also, खून पतला होने की दवाई चालू है क्या? So logically also, if patient is on such drugs, and if you are doing extraction soon, then clotting will be an issue. Now there are many controversies related to this, whether we should stop or we should continue, but at least you should know that there is something called aspirin, which is have antiplatelet. So platelet aggregation is affected, clotting will be affected, and there can be a bleeding issue post-operatively, like patient may have prolonged bleeding. So you should be prepared that. Now how to be prepared? You will not stop antiplatelet because some purpose. To stop if some cardiac episodes occur, who is responsible? So that has to be done by a physician who has prescribed him. So we should ask physician, in return we kindly give fitness to stop antiplatelet drug for the minor surgery or for any procedure you are doing extraction. If he feels that it is safe for the procedure, safe for the person, he will antiplatelet. If stop, then you can infarction can be there. Then we need to wait it. The procedure usually 5 to 150 milligram, it is manageable. Stopping aspirin, we can do it, and we different can do pressure. That is the most simple. Maybe for more time, put gel form. So we should know the role of antiplatelet. To stop them or not to stop them is completely a call taken by physician, not by dentist. If they stop, it is well and good. Generally, it is said that half-life of antiplatelet is 7 days. So they usually try to stop it for 5 to 7 days prior to procedure and start it next day. Okay, starting it is also important. Then if they don't stop, take the measures like gel foam and suture. Now in the literature, there are different studies done where antiplatelets are not stopped and the procedure is done without any uneventful happenings. But we should be careful, take physician consent and try to stop it if possible. Why to take risk? Then always reduction of stress and anxiety. This is not only for any patient. You can follow these protocols. Always do good communication, stress reduction protocol you can do with any patient. Anyone has stress. Even someone asks me कि extraction करना है आपका, तो मुझे भी stress आ जाएगा. It is very natural. So always try to do good counseling, prepare the patient well. This is important for everyone. So if the stress part is more, you can give for that medications like diazepam can be given, clonazepam can be given night before, so that he will have good sleep, and in the morning also can be given. If more anxiety is there, so you can give injectable diazepams also for anxiety control. Then when multiple extractions are there in such patients, try to do a segment of it or start with only one extraction, see the response, and then in the next appointment maybe you will be doing the latter part. So don't do extensive work in one go. First quadrant wise we can go. And be prepared. This part will be dealt in detail in next presentation, but related to this angina is how we should be prepared. We should be prepared in emergency. We should have sublingual nitroglycerin. If patient develops pain, we should be prepared. We should be giving nitroglycerin. There are many cardiac situations. Everything cannot be discussed here. Then there are bleeding and clotting disorders. So like from CBC, we advise the patient complete blood count, bleeding time, clotting time. From that, before any procedure, usually we advise these things: bleeding time, clotting time. From that, we get bleeding disorder hai kya, clotting disorder hai kya, and specific like hemophilia. Usually from history, we will come to know. Patient knows everything about these things. कि मैं फैक्टर लेता हूँ या और कुछ इंजेक्शंस लेता है क्या, कहाँ से लेता है. Am I audible?
So PPT is not visible.
Oh. 1 second. It's visible now?
Yes, sir.
Yes, sir.
Okay, thank you. Now, bleeding, we are talking about bleeding and clotting disorders.